Hey guys, welcome back to another n8n video. So the previous video we spoke about AI medication dispensing through n8n workflow. Today we're going to talk about treatment plan and commitment workflow. So think along the lines financial counseling, consent taking, bill estimation, and everything regarding care plan options. Like if there are three options out there, how do you discuss with the care team, right? So I guess the starting point would be, what if your clinic could guide a patient all the way from we need to talk about your care plan to your appointment is confirmed and here's what to bring, right? So that's essentially the whole process of a care coordinator, the whole process of financial counseling. And most clinics actually send a very generic message to say, hey, here are the three options out there. Patients are expected to choose or know what are the ins and outs of these three options. So patients don't understand the risk of these three options, and perhaps maybe they have not been interviewed of their lifestyle, their financial situations, and the care team hasn't even agreed on the options, or maybe are not clear of all the options. So in that sense, this n8n workflow is kind of like a little feedback loop where AI kind of like generates the clinical options for the care team to review before the patient sees it. So you don't have to think too hard about, no, the care team doesn't have to think too hard. Oh, how are we going to, what is the best care plan for this patient? So in that sense, the AI does that initial layer to review what are the options out there. But what is very interesting is the next step, that even after getting the clinical options, the three clinical options, it's not over yet, because you still need to interview the patient to understand his or her constraints, goals, affordability, as per what financial counseling is all about. And phase 3 is really about explaining every single option to the patient in detail. You can do it through WhatsApp, through phone call, through SMS. And apart from the three options, there should be one more option called do nothing. Because the do nothing is also an option, because there is always that option that maybe people just don't like having a risk at all, right? So, and of course, phase 4 is really getting the consent. So consent taking is one of the key things in healthcare, where you need a formal consent through signature, and most likely signature. There's nothing else. And in a way, financial checks, and the choice gets locked in. And of course, even getting consent does not mean that on that day of the appointment, or the treatment, the patient would show up. So that's where this flow also has a check for 2 days before appointment. We'll reconfirm whether the patient wants to come for the treatment plan, because you know that they could have a change of mind. And of course, we could also have a flow that collects deposits for private or foreigner patients, and send the patient a final pre-treatment checklist. So it's pretty long. So let's try and get through this in the next 7 minutes. Okay, so as I mentioned, the workflow starts with the webhook right here, where the consultation is marked as completed in our electronic health record. You could use open MRS, you could use a homegrown system that has a EHR out there. It fires a post request through n8n, and after that, it kind of like we fetch that patient record in that sense, with all the necessary medical history, insurer type, private or subsidized, and which insurer the patient is on. And this is very critical, because it feeds later down the line of the billing stack. And it also helps kind of like create that clinical options as well. It's part and parcel of it. So that's where it gets very interesting, where instead of humans sitting down to draft treatment options, we have the AI to generate the initial set of clinical options. As I mentioned, there will be 3 and one more, which is the fourth one, which is do nothing, right? And the AI does all the profile reading, clinical rationale, key risk, and key benefits. and even estimate the duration of the treatment plan as well. So the prompt is very specific. It's kind of like a more clinical decision support role that the AI plays. And at the end of the day, they also do the bill estimation because they check each option, which whether is it Medisave claimable, how much the insurer has to cover, how much out of pocket there is. And here's the key design principle where the patient hasn't seen anything yet. Right? The AI output goes straight to through Slack, through the care team, for the care team to review. Right. So the care team will say, okay, is this appropriate? Is this what AI generating is appropriate? So this is the human check that the humans will not be replaced by AI is through this little check right here. So then the workflow actually waits for this little workflow here waits for the care team to approve, right? And then once the approval has been made, right, it's been sorted, we will after that wait 2 hours before contacting the patient. This one you can decide how many hours you want. And then you can send an SMS, you can send a WhatsApp. Preferably WhatsApp would be good because there's a lot of ding-donging with the patient. And of course, here you can set your little conversational AI. You can even call the patient for conversational AI if you wanted to. I'm keeping this very simple because of text-based. Conversational AI will be better, I guess, for if you had to improve this workflow. And then we will go through this because an interview is required. Most of it is an interview is required. So we will kind of like interview the patient and literally ask, what are your like constraints, are you okay and any financial constraints, and what are your thoughts about that, any risk that we want to address. This is where we kind of like AI summarizes everything and explains the options to the patient. So you have your option A, B, C, we'll explain it all A, B, C. And at the end of the day, even an option D, where we would kind of like also entertain the part where the patient says do nothing, right? So then this whole thing allows you to kind of like so-called audit trail the conversation with the patient and lock the final consent. So once the final consent is given, this is where we talk about patient choice. So we'll validate the patient choice. Is it a valid choice A, B, C, D? With the interview results as well. So if the interview results kick in and everything is okay, we will proceed to the next stage where it kind of like is the whole finance reply and everything. So there will be this little finance comfort check, and then we will check whether there's all that admin work that is required, and then we will check whether the once the financing comes back, and we wait for it to resolve, and we will get this little thing for consent requests. So once we send that consent to the patient will give their consent. We'll store that consent in our consent record. If no consent, we will actually activate a Slack workflow for that. And of course, if there is consent, we'll store it back into the electronic health record database. And then we'll trigger the appointment reminder, WhatsApp confirmation, and wait 2 days before the appointment before we trigger another pre-treatment reconfirmation. So this is super crucial because people do change their mind even after consenting X days before the treatment plan. And once we receive that reconfirmation, if there's a change of mind, if there's no change of mind, if there's a change of mind, we'll log it in. If there's no change of mind, we'll check if it's private or subsidized. And actually, if it's a private, we'll request for a deposit payment. And if not, then we'll share the WhatsApp treatment instructions to the patient. And before the day, we'll send another day before reminder and update in the electronic health record status that the pre-treatment plan is ready. So all in all, you can see it's pretty complicated, all the way from and because this is really what a financial counselor goes through, where the financial counselor runs through all the clinical options in mind, and then contacts the patient and does the interview with the patient to share all the options with the patient, and after that receives the patient choice out there, validates it with internally whether the patient can really pay based on the coverage. And after that, gets the consent, stores the consent somewhere in the system, triggers that appointment booking, reminds the patient of the treatment plan, do another reminder to the patient to make sure there's no change of mind, and send another reminder on the day itself for the treatment plan. So you can see this is pretty complex, but it's also very comprehensive, that it covers the end-to-end treatment plan and get consent, which is very, very important. So yes, my name is Dexter, and if you have any comments on or suggestions on this change of this treatment plan workflow, do let me know in the comment section below. As always, if you like this video, remember to like, share, subscribe to our YouTube channel, and I'll see you in the next one. Bye!